Welcome to the cross-country conversation webinar series hosted by Pharmacists Without Borders Canada. My name is Nicole. I am the Manitoba lead for Pharmacists Without Borders, and I am going to be your host for the webinar today. Now, if this is your first time joining us, this webinar series has focused on different pharmacy specialties, and we've been interviewing pharmacists from around the world talking about how COVID-19 has impacted their practice. I am really excited today to be joined by two other pharmacists, and we are going to be talking about the world of pediatric medicine. So my first speaker today is named Feroza Perveen, and she is a senior pharmacist at a tertiary care hospital in Pakistan. My second speaker today is Stephanie Dean. She is also a pediatric hospital pharmacist. She's actually the team lead for her for general pediatrics and an endocrine pharmacist at the Children's Hospital of Eastern Ontario in Ottawa. So welcome, ladies. Thank you so much for being with me today. I personally hold the area of pediatrics very near and dear to my heart because I do have previous experience in it. So I am very curious to hear about how COVID has impacted your practice. So welcome again.
Yeah, thank you for having us.
I'm just going to dive right into it, and I'm going to address the first question to you, Feroza, if that's okay. And Feroza is going to speak to us without video today. It's just a little easier for the connection in Pakistan. But Feroza, I know Stephanie and I and all our viewers are going to be very curious to hear. Can you describe what the COVID-19 situation is like in your country in Pakistan?
Sure. Good evening, everyone. My name is Feroza Perveen, and I am senior at Aga Khan University Hospital, Karachi. Aga Khan University Hospital is one of the biggest tertiary care hospital of country. It is JCIA, ISO, and CAP accredited hospital, comprises on 700 beds, more than 700 beds. As you know, we are facing COVID-19 situation, and the current prevalent situation of COVID-19 in Pakistan, as per government official, is better now, with less active cases and a sharp decline in number of deaths. If we talk about stats, so in last 24 hours, there was 584, more than 500 active cases are reported, while deaths were 4 or 5 in numbers since last 24 hours. Till date, we are working on the guidelines and the policies that we developed initially and modified as per the change in the institutional policy based on the influx of suspected as well as confirmed COVID cases. And increase in number of patients bed for such patients. Still, we feel that we need to develop more extensive system to handle the situation. The strategy could include changes in clinical guidelines in the management of clinical critical patients. For example, turning COVID patients with respiratory distress into prone position, and use of immunoglobulin extracted from plasma of previously COVID positive patients, and some other strategies.
Yeah, so of course, unlike everywhere in the world, I think that everyone is still adapting and things about this virus are changing. So yeah, we are all changing our standards of practice as we go through this. Stephanie, can you comment on either pediatrics or just in general what COVID-19 looks like in Canada right now?
Yeah, so in Canada as a whole, we've had about 135,000 confirmed cases. We've had active cases right now are about 6,700, and we've had about 9,000 deaths. So kind of in comparison to the rest of the world, we're doing fairly okay. In comparison to our neighbors in the south, we're doing pretty good right now. In my area where I live in Ottawa, which is the capital of Canada, we have had 3,200 confirmed cases, 267 deaths. Large majority, I believe 230 of those have been from long-term care outbreaks. So that's definitely the area that's being hit being hit the hardest right now. We were in a more strict lockdown situation from about March to July, with really only majority of businesses and stores and restaurants being closed. We've progressed now to that was stage 1. We've progressed now to stage 2 and now stage 3, where pretty much everything's open with some limitations on numbers of people. We can gather and have social events with limitations on number of people. And for the most part, there's mandatory masking required in public areas. I know where I live, but everybody's being very adherent to that, which is amazing. Yeah, so continuing to flatten the curve, but still more work to be done for sure.
Yeah, wow. I know here in Manitoba, I mean, we were on lockdown for a couple, like until May, so a little shorter than you. But I mean, when you're in lockdown, a couple months more feels like a long time. So
long time, yeah. Yeah.
Absolutely good for you guys. Feroza, are there any impacts of COVID-19 that may be unique to your country in particular?
Yeah, Pakistan has unique socio-economic impact of COVID-19. As a smart lockdown which it imposed is now over, and business and financial activities are now resumed to normal. Also, the country has experienced a joy of festive celebrations on Eid, which was very unique in the region. Also, a school which were closed as to employ with protective measures will be presuming soon, with implication of proper SOPs, as children are more prone to get infection. So all precautionary measures will be taken accordingly.
Perfect. Definitely, I can already think of some things that have been kind of unique, I guess, to us in terms of COVID-19. Can you speak about how its impacts may be unique to Canada?
Yeah, one thing that kind of stood out for me when I thought about that question was our Indigenous and more remote communities and isolated communities that don't really have easy access to healthcare. We're definitely working to try and protect them as hard as possible. And as far as I know, for the most part, we're doing quite well in that aspect. Our hospital serves a large area of Nunavut, and we get a lot of patients from that area. So I know before they return back to Nunavut, they have to do a mandatory 14-day isolation to ensure that they remain asymptomatic before they can go home. So that's kind of one aspect that I thought was kind of unique to Canada. I mean, school's starting up this week, or well, this week and last week. So that's definitely a big topic right now. So it's basically a mix of in-person and virtual learning. In my area, at least, the high school students are doing kind of half and half. The elementary students are doing mostly in-person learning, but with measures such as staggering returns, cohorting of students, smaller class sizes, mandatory masking, all of those things. So is there anything else you can think of?
No, yeah, I think we've really been battling with the back to school this week in particular, and I don't have to myself. Of course, I don't follow the back to school protocols very closely and what they're doing, but in general, from people that I've spoken to, parents and teachers are very excited that kids can go back to school with some apprehension, but I think the general kids need to be back.
Yeah. I know our hospital was very kind of vocal in the media about the impact on kids' mental health, being away from their normal routines, away from their friends. So while it is for sure a scary thought to return to school and something that we need to take seriously, I think it's very important that kids are heading back to school now.
Absolutely, I agree. Okay. Feroza, can you talk a little bit about how your community or your country has adapted to COVID-19?
Yeah, sure. As we all know, the outbreak that started in China in a very short time frame has involved many other countries. And Pakistan is a lower middle income country. And for Pakistan, it's like a disaster. We already work in a compromised setup with limited healthcare resources. Here, majority of the population is deprived of basic necessities of life. So fighting with pandemic is a real challenge for us. First case, I remember it was reported officially in the end of Feb 2020 in Karachi. At that time, after only 3 deaths were reported till mid of March 2020 due to COVID-19. And then there was sudden rapid rise in the cases. 1 week later, the government announced a complete lockdown of the country. The initial stage of COVID-19 for Pakistan was confusing and questioning for steps to be taken as like other countries. But then, till date, Pakistan has effectively coped up to the COVID-19 pandemic situation, ensuring following of the proper safety measures and health hygiene measures as stated by WHO. Also, it implemented that strategy of smart lockdown, which curtailed the cases and resulted in decline of active cases. Hospital and public areas were encouraged to reduce child exposure by not allowing them to enter with parents. Overly populated areas and entertainment zones were closed for special population like pediatric and geriatric. Further, Pakistan is a lower middle income country, so there is a greater need for pharmacist support where pharmacists are unable to afford the doctor's fees for a consultation. In our country, people are usually access nearby pharmacies, which can get them medications without paying them for consultation. They just need to pay for medication if needs. This could be a greater window to showcase the role of community pharmacists in lower middle income country, particularly during a time of a health emergencies in COVID-19. Pharmacists are working to provide home deliveries during that time period as well. Also dealing with increased number of patients coming through the pharmacy with other disease conditions. So that was a very challenging time period, and in that time period pharmacists played very well, and now still we are working on some different policies procedure to ensure the safety of patients and participate in patient outcome.
Yeah, thank you so much for sharing that, Feroza. I can't imagine that would be, of course, it's been a lot for everyone to adapt to. So it's nice to hear about the role of pharmacists and how community pharmacies are adapting and can provide a greater service to their patients.
Yeah.
Stephanie, how do you think your community or Canada has needed to adapt to this virus?
I mean, majority of the aspects of our life have changed right now, so we're adapting in many ways. As I mentioned before, there was the mandatory lockdown and moving through the different phases of reopening. So right now we're at a point where we're basically fully open, but we're all kind of cautiously moving forward, knowing that we could return to a lockdown situation if cases start to rise. So I mean, for the most part, I think it certainly in my area, and I think Canada in general, majority of our people have jumped on board with universal masking and social distancing measures, which has helped greatly in reducing our case numbers. Really, not any non-essential travel is discouraged at this point. Yeah, so I think as a whole, we're adapting quite well. It's been kind of so long now, I feel like it's just our new way of life, which is, I guess, a little scary, but I think we're all adapting pretty well. Yeah. It's really interesting to hear, Feroza, about the role of community pharmacists in Pakistan. That's really encouraging and something hopefully I hope that we can move forward with as well. I have heard, I'm not sure if it's official or not, about the government reaching out to community pharmacies to offer testing, which would be amazing. We're Canada as a whole is our testing is fairly good, fairly wide access to testing. I know at the beginning it was limited only if you had kind of the classic symptoms, fever, cough, and you had travel exposure. So that really kind of reduced the amount of people that had access to testing, but now it's opened up wide and anybody can go for really any reason in Ontario anyways. So testing is definitely becoming more widespread, which is great. Yeah.
Yeah, it's been a lot of adapting this year. We'll just say that. Another big issue has obviously been mitigating the risk of infection spread, whether that's in the community or hospitals, everywhere. That's what we're really focused on. So maybe I'll throw this question to Stephanie first this time. Has there been anything in particular that your hospital has taken to mitigate the risk of infection spread?
Yeah, quite a few things. So every day, every staff member that's going to come on site to the hospital is required to do mandatory screening to fill out a questionnaire before we even come to the building. And if we do not pass the screening, we have to contact our occupational health department, and they recommend, they provide further guidance on testing or what needs to be done next. Our hospital has actually recently started to offer testing to our staff members, so we don't need to go to the testing, like the community testing sites. We can just go to our emergency department, which is interesting because we're a pediatric hospital, but we're testing adults, so that's kind of cool. We of course have universal masking, so the moment you step in the building, you get a surgical mask. If you are not having any direct patient contact that day, you can just wear a regular surgical mask. If you're going to be seeing patients and being in contact with them, you wear a mask with visor. Okay. We've been lucky that we haven't had any PPE shortages. We've always had the appropriate amount of PPE available, which is amazing. And I know at the beginning, so because we were doing quite well in pediatrics, our hospital actually lent out, I suppose, some of our staff to some local nursing homes that were really struggling. So I was one of those staff members that volunteered to be deployed. So I got sent to a long-term care home. Yeah, which I ended up getting COVID, but
from the long-term care home, if you don't mind me asking.
Yeah,
wow.
yeah. So that was an interesting experience. I mean, I'm obviously fine, and it was mild, but so that was interesting. The hospital really supported the staff that way. We brought in our infection prevention and control team. We brought in our infectious disease team, our environmental services teams, to kind of support the nursing home staff. And they also, the hospital was offering to provide alternative housing for people that were going to be exposed to COVID, so that they didn't have to bring it home for, staff members that have young kids or elderly family members or whatnot. So they did a really good job there. Yeah, I think that's kind of everything.
Great. That's really interesting to hear. Like, I've heard of things of different housing for different hospital staff. I don't know, to be honest, if that's something that we've done in Manitoba. I don't think so, but it's good to hear that you guys have done that. Feroza, can you talk about how maybe your site, what kind of steps they've taken to mitigate infection risk?
Well, AQH was very vigilant for hampering the spread of infection and ensure proper following of safety measures, creating awareness amongst the staff for following proper SOPs through emails, through leaflets, and adequate supply of PPEs to every staff member. Screening counter was set on consultant clinic entrance and on OPDs, where temperature was screened and proper sanitization of hands were ensured by dedicated nursing staff. Also, dedicated staff for COVID-19 patients were given extra protective equipment, as like use of respirator and multi-layer gowning. Further, the spread was curtailed by making sure that there was no overstaffing crowding in particular area. Also, a specialized pediatric isolation wards made, and with ventilator support and necessary equipment were set for affected COVID pediatric population. Hospital made sure that employees get their respective salaries and reimbursement at times, so the financial matter of employee family would not get disturbed. Hence, ensure patient safety, employee satisfaction. Health allowances were also provided as like previous policies. Staffing was another challenge during this time period. As you know, many pharmacists in pharmacy department got infected with COVID-19. So they need the isolation as per international guidelines and policy procedure. So in their apps in that time period, pharmacy management has to plan some strategy. They develop some strategies to ensure that 24-hour continuous supply of medications and surgical items to continuity, ensure the continuity of care 24 by 7 in such a big tertiary care hospital. That was also a main challenge. And as we know, AQH is a tertiary care teaching hospital, so learning aspect is very important. And so in that case, they develop some strategies, some online session, so staff get proper training and knowledge, updated information as per guidelines. So these are the some challenges we faced and make some strategies to resolve them during this time period.
Yeah, it's I think this virus, it does spread like wildfire, right?
Yeah.
In ways. And I know our managers have done a lot of planning in the event that pharmacy does get hit with it, and pharmacists and technicians assistants.
Yeah.
So I can't imagine you guys dealing with the fact that your department, actually a lot of pharmacists did get it. That would be very stressful.
Right.
I did want to ask you guys both this question specifically, because I know it was a big deal when I was in pediatrics when COVID kind of just hit. Even with just, for example, not being allowed to have as many visitors in hospital, these kind of things is stressful for an adult, but that's completely different when you can't offer the same support for a child. So Stephanie, was there, or what did your site put in place to offer support for families and children in your hospital?
Yeah, so certainly a very big topic in pediatrics for sure. So we did have visitor restrictions. Only one parent was allowed to accompany the patient, which could be certainly very tough for families. There were special circumstances where that rule was overridden. So, you know, it wasn't completely inflexible, which was great. We have these wonderful people, staff members at the hospital called child life specialists. And one of their roles is to help kind of normalize the medical process for children, because it can be super, you know, confusing and scary for a child. So, I mean, they've been on kind of double duty really with COVID, trying to explain to children, you know, why their doctor's dressed up in a crazy outfit and why everybody has masks and face shields and things like that. So I think they're doing an amazing job to try and normalize some of that for kids. We did have an initiative where there was a photographer on site who would take picture of all the staff, and we would wear buttons with what our face actually looks like, so that the kids,
Nice.
you know, could see. Yeah, so the kids could see that there's a human under there, which I think is important for them. We also, you know, they came up with videos to try and explain, you know, at a child level, you know, the virus and why we have to be careful of it, and, you know, why the healthcare providers look like, you know, they're wearing funny outfits. Our hospital has actually done a great job as well of being very active in the media and providing a lot of resources for families who are confused, especially right now with back to school, because parents could choose whether or not they wanted to send their kids for in-person learning. There was a lot of confusion on which route to go, and especially with kids with chronic illnesses, that was a big thing for parents to make that decision. So our hospital put out a lot of statements and kind of advice, which I think it was a big help for families trying to make that decision. Yeah, and then of course, you know, our social workers were always there to help support, give any resources that families need to make it through this time. Yeah, so we have a lot of really great healthcare providers at our hospital that really help to try and get families through this time.
Yeah, you guys have done some great little initiatives there to try to even offer some support during this stressful time. That's really nice to hear, actually.
Yeah.
Yeah. Feroza, how about your site? Have you guys done anything different to offer support to families and children?
Well, that's a very important question, and for sure. As far as my hospital is concerned, so when the need for proper counseling was raised, after certain queries from the staff, including mothers, who were very concerned for their children regarding their health issues, arrangement of live counseling sessions and webinar were made, and that emphasized COVID-19 impact on thinking of individuals and the practical solution to it.
Right. Okay. And Feroza, I'll bounce this question to you now again. What about your staff? Has your hospital done anything special or different to help provide mental support for you guys during this stressful time?
Yeah, they arrange different webinar, different sessions. Along with that, they appreciate by different meanings, like during that time period, they give us some coupon of for appreciation and some incentives also. So that was very encouraging for employees. They never cut down the salaries and other medical benefits, although hospital went to loss in terms of finance, but even then they supported their staff, and they plan some different activities for staff mental health. They arrange different webinar, different sessions online, so staff can get some relaxation through different positive and motivated sessions. And upper management in our hospital encouraging our staff to work more efficiently uh, for patient care.
Okay. Great to know that you guys are doing
Yeah.
some webinars for the staff. Stephanie, how about you? I know when COVID hit here, there was a ton of confusion, a lot of stress. What has your site done to help with the mental health of staff?
So I mean, our hospital is great in that we've, even before the pandemic, we've had free access to mental health counseling if we need it through our occupational health. Yeah, which is awesome. So I mean, I know that's certainly something that continues to be available to us. A lot of just open communication with the higher level executives, which has been awesome to really kind of show that we're all on the same page. We can get our questions answered. So I know at the very beginning, when there was all kinds of confusion, they were doing big, Zoom calls with all the staff where we could just freely ask questions and get answers. And so I think that really helped to kind of find some answers to these questions that we didn't know. I know, like, after my time in the long-term care home, we were offered these sessions of kind of reflection and I guess just a venue to talk about our experience with actually some of our hospital psychologists, which was really, which was great. Because I mean, that environment, we saw a lot of very sad things, and so there were resources available to us to help process that, which was I was very grateful for. Yeah. So I mean, my hospital in general is wonderful in that they're always very supportive of their staff, but I just found kind of during the pandemic, it's been even more so, which has been awesome.
Yeah, that's really great to hear. I mean, it's obviously very difficult to support tertiary care sites because they're so big. I think it's awesome that you guys are offered counseling because that's a service that can be quite expensive even if you have insurance. So that's really great.
Yeah.
Feroza, can you talk about, and I'm going to group these two questions together. What was kind of your clinical practice before COVID-19, and what has now changed operationally now that we're dealing with this virus in your practice?
All right. Well, that's a very important question, and we assuring that every pharmacist or staff present at time were following proper SOPs provided by the Infectious Disease Control Board, which include the use of hand sanitizer and use of proper mask with maintenance of social distancing. The situation was impactful for daily routine, as it enabled us to following proper hygiene measures, which were overlooked previously. Also, we were extra vigilant in patient care process and medication review of specialized pediatric population as to reduce the comorbid and incidences which can occur due to disease complication and medication error.
Yeah, so it sounds like a lot of your practice has changed in of course,
Yeah,
all of us, like
yeah.
being aware of the infection risk and
Hmm.
spreading and these types of things. So
Yes.
that would for sure
This
change.
situation, yeah, this situation make us, to see things more critically and more cautiously as we previously did. So that's a very good thing.
Yeah, yeah, for sure.
Yeah.
How about you, Stephanie? Can you describe, I guess, kind of what your practice was like before COVID and how have things operationally changed now with the virus?
Yeah, so pre-pandemic, my day would start with morning bedside rounds. So we would actually go to each patient's room and round outside their room. So it would be, the pharmacists, the physicians, the nurses, the med students, the residents, dietitians, respiratory therapists, all kinds of people all gathering. And so certainly that's changed. We're no longer doing rounds physically at the bedside. We've moved rounds to an entirely virtual platform now through Zoom. And that allows the different care providers to remain in their kind of own physical space. And what was really important for our hospital in kind of modifying rounds is to still include the patient and family. Our rounds are always family centered. So we now have an iPad that we give to the parents and families to join us on rounds. Yeah, which is great. They're such an important part of the medical team, really. So that was something special that we've done. So we're still doing that. Initially, when the pandemic started, the majority of the clinical pharmacists, pretty much except for, the dispensary pharmacist and the critical care pharmacist, we were all asked to work from home. Yeah, which is interesting for a pharmacist. Really, it was possible because of our electronic health record it's entirely electronic, the system that we use. So you can, review patients, look at their charts, everything from home, and join rounds virtually, and speak to physicians and nurses virtually. So that's essentially over now. Majority of us are back on site. Yeah. I guess it's been a bit of a struggle for me personally to try and maintain, kind of my presence with the medical team. Because prior to COVID, I would sit up on the floor and be freely available to nurses and doctors for questions and support and whatnot. So now being down in my office trying to achieve all that, being separated is a little more difficult, but we're working out a good system now. Yeah, so we're kind of settling into our new normal. We'll probably be like this, and into next year, continue with the virtual rounds and whatnot. So
how long did you have to work from home for?
I want to say from like March to June.
Okay.
Yeah, it was a fair amount of time. Yeah, but it was challenging at times, but you could still get all of your work done. You could still be a functioning clinical pharmacist. What really I missed out on though was actually like interacting with the patients, doing discharge counseling, answering questions, things like that. We would, call them over the phone or schedule a Zoom call with them, but a little bit different.
Yeah, I hear you.
Yeah.
Well, here we never did work from home, but yeah, I can't imagine that would be tough to do. So I commend you for doing that. Yeah, that's awesome.
Pretty happy to be back on site now, but yeah.
Feroza,
Yeah.
some of the new ways you are treating COVID-19 patients, and how have you adapted your practice to do this, and were there any challenges to this?
Well, in Pakistan, the situation is stuck, since the COVID-19 outbreak. Pharmacists, along with other medical professionals, are working 24 by 7 to save life. After enforcement of lockdown, pharmacy, either hospital or community, are the only services operating round the clock around the country, across the country. Sorry. During the pandemic, in addition to community pharmacies and COVID-19 related rule, hospital pharmacies provide an essential services to patients, both inpatient as well as outpatients, and mental health care team through the supply of medications and pharmaceutical care. Pharmacists ensuring the continuity of these services is essential. So ensuring adequate storage as well as supply of appropriate stock of relevant medications and other medical products and devices to supply the demand, that was the biggest challenge. Also, there is a growing demand for telehealth and telemedicine has already been used in Pakistan with the doctors, nurses, and other healthcare providers. Pharmacists physically present in the emergency, isolation wards, and quarantine centers. So pharmacists can hold on to this and can ease the patient distress by providing triaging and basic consultation via telemedicine, taking the burden off the doctors and healthcare system.
Yeah, this is really an opportunity where pharmacists can take
Yeah,
the burden
definitely.
off things
Yeah,
that doctors and nurses can do, but we can also do as
yeah,
well.
yeah,
Yeah.
definitely.
Stephanie, I think you kind of already did talk about this a little bit in that you said you work from home and that's a different way you're treating patients, but is there anything else you want to add?
That's very interesting, I must say, because we are working in a tertiary care hospital, so there is no concept to work from home. So you have to be here on time. You have to continue your duties. Even we did a double or triple duty sometime in case of shortages of staff, and some staff got quarantined at a time, a large number of people. So in their absence, we have to manage all duties. We have to ensure the continuity of care. So we work very hard during that time period. But the situation is getting better now, alhamdulillah. So we are not complete, but bit relaxed now. And hopefully we will see the good situation in upcoming days.
Yeah, that's a good point. We don't really have the option to work from home, but
Yeah.
things are getting a little bit better now and a
Yeah.
little bit more relaxed. Stephanie,
Yeah, never when I chose a pharmacy as a career did I think I would get to work from home.
no, not at all. Do you have anything else to add to that, Stephanie, in terms of any new ways you're treating COVID-19 patients and challenges with that?
Yeah, I mean, we've been really lucky at my hospital. I think we've had 3 admitted COVID positive patients, so we've been very, very, very fortunate. Only one of them required an ICU admission, and they didn't even need intubation. They just, got by with non-invasive ventilatory support, which was wonderful. Kind of the big topic in pediatrics right now with COVID, I think, is the pediatric inflammatory multisystem syndrome, PIMS. It kind of provided, I think, physicians some diagnostic challenges because it can present like other syndromes like Kawasaki disease or toxic shock. So that's kind of a bit of a focus for us right now, is identifying those patients, and we haven't had any, luckily, so that's been great. I mean, our site is kind of treating every patient with an abundance of caution, so anyone presents with a fever automatically gets tested and isolated until their test comes back negative, which is, precautions to protect the patient and family, but as well as the staff. We've done a lot of telemedicine because initially a lot of our outpatient clinics and non-essential, procedures and things like that were shut down. So now we're opening them back up, but we're also using a lot of telemedicine as well, which has been really great to still, stay connected with patients, but physically distant. So yeah, there's been a few kind of new processes that we've adopted that have been quite interesting.
Yeah, there's definitely a lot of different things you'll be doing now in so many different areas, like not only technology, telemedicine, but you talked a little bit about the symptoms of COVID, like Kawasaki disease in kids. And that is one of the ways that shows me how scary this virus is. Like it presents in a lot of different ways, and in adults too, things like blood clots or these types of things. So yeah, our practice is changing in so many ways that we don't even really think about actively, but it is.
Mm-hmm.
Yeah. Feroza, has your site dealt with any drug shortages, or has your country been impacted by any drug shortages during this time? And has it affected your practice?
Drug shortages was problematic as patients were forced to acquire medication at higher prices from retailers, and non-availability of drug took longer time for provision of doses to patients. That was a problem. Shortages of medication found due to fast spread of COVID-19 in the country. Demand was very increased. So to cope up the requirement, the government asked the Drug Regulatory of Authority of Pakistan for fast track registration of drug, which had already been registered in USA and Europe and were used to treat COVID-19. So to facilitate, if government asked the Drug Regulatory of Pakistan to import of such drug if not manufactured locally, and also facilitate local production under license on fast track basis to ensure the continuous and smooth supply of essential medicine and surgical items to patients.
Okay.
So drug shortages was a real challenge, no doubt about it. There are many drugs we used for to treat COVID-19 patient, which was not registered and which was not manufactured in the country. So in the beginning, we had to arrange all those medication from abroad and different countries. So that was a real challenge, but with the passage of time, government support us and they make arrangement to get those medication from market and use them for treatment of COVID patients.
Yeah. Drug shortages have been something we're dealing with in Canada too. Stephanie, can you talk about how drug shortages have affected us and whether it's affected your practice?
Yeah, so we were lucky enough that there was the concern over drug shortages, but it never actually reached kind of our patients. We were able to still provide all the proper medications to our patients, but certainly we were concerned about it. So we changed our practice a little bit in things like repacking some of our medications into smaller sizes. I mean, our population is pediatric, so our little babies don't use full vials of drugs, so we would repack them into smaller sizes to try and reduce wastage. Which worked very nicely. We're also now almost, I guess, in preparation or in case of a second wave. We've started to, we received permission to sort of stockpile the critical medications that we need in preparation for, a potential shortage, which we hope doesn't happen. And then I know on an outpatient level, there was a lot of people trying, to fill their medications early or get larger supplies so that they could create kind of their own stockpile at home. So in Ontario, they imposed a rule that we could only receive 1 month of medication supply at a time, just to ensure fairness and to prevent, people from hoarding meds, apparently, essentially. So that was a bit of a challenge, I know, for my colleagues that work in the outpatient setting. Something kind of unique that our hospital did that isn't necessarily a shortage, but I find quite interesting is we tried to reduce our use of nebulized medication because that's an aerosolizing procedure, which requires N95 and pressurized rooms. So we, one of our biggest, things like salbutamol that have MDI inhalers available, we need to switch to those if at all possible. But one of our big nebulized medications that we use is epinephrine. So we actually I believe majority of the pediatric hospitals in Canada end up doing this as well, but we went through the special access program to basically import the epinephrine inhalers so that we could use MDI inhalers in place of nebulizers. So that really was kind of an interesting thing that we did to try and reduce the use of nebulized medication. So, and it worked very well.
Yeah, that is interesting. I never thought of that. I kind of was leaving pediatrics as COVID was just starting. So I'm curious to know what our children's hospital did.
Yeah, I believe it was kind of across the country. We all did that. But that was certainly a big focus at the beginning, was how do we reduce our aerosolizing generating procedures to conserve PPE and protect staff and patients and all that. So that was something that we were able to achieve very quickly, which was great.
I'm going to throw this question out to both of you, so whoever kind of wants to speak first. How have pharmacists in your hospital been involved with research surrounding COVID-19, whether it's COVID-19 treatments or infection mitigation, these types of things? How have they been involved?
Al Khan University Hospital is a tertiary care teaching hospital, as I told you. So at AKUH, pharmacists were encouraged to participate in any of research projects that were specifically related to COVID-19 treatment. They were asked to gain knowledge for COVID-19 treatments provided by global guidelines, and also for timely updation of knowledge provided by WHO and CDC. Different data on medication response on pediatric population was gathered and assessed for optimization of drug use. Besides this, there are many research and quality projects conducting in Al Khan University Hospital and many publications. So that was a very good thing. And pharmacists also participated in different quality and research projects, particularly related to this COVID-19.
That's really nice, Feroza, that you guys are highly encouraged to participate in these types of things, especially during such a stressful time when you guys have been hit by COVID and things are really tough. So that's nice to hear. How about you, Stephanie? Anything that your pharmacists are doing in terms of research? I know in like where I work, obviously it's really nice for pharmacy to be involved in research. It's often just a lack of time for these types of things.
Yeah, I mean, I think the fact that our patient population is not very affected by COVID at this time has kind of meant not as many research opportunities maybe as our adult cohorts. I know we were getting involved in some clinical trials for different COVID treatments. Yeah, so we got a little bit of involvement in research, yeah.
So just to kind of wrap things up and tie things up, I'll ask one more question. Feroza, if there's, I guess, any key message that you'd want to pass on about COVID-19, either to your patients, your colleagues, anything like that, what would it be?
Well, my message will be that people should not consider that we are over through this pandemic, and hence shall follow the protective measures as we previously did. Remember that prevention and treatment for COVID lies in self-care. So we should believe that the pandemic can be controlled effectively if vigilantly handled. So in the end, we are hopeful that we will be more equipped in terms of flow process as well as clinical knowledge to brave these difficult times more strategically and to provide safe care to these patients. And last but not the least, I would really like to thank you for giving me an opportunity to share my experience with all team members, and it's really a learning and a good opportunity. So thank you so very much.
Well, thank you, Feroza. And I think that's really lovely what you said about kind of getting through this pandemic, and such a big part of it is self-care. Like, you're not going to get through this without taking care of yourself.
Thank you.
And it's been difficult for a lot of people to do that. So it's a really great thought. Yeah, I really like that. How about you, Stephanie? Any last message that you would want to pass on to your patients or your colleagues or anyone about COVID-19?
Yeah, I think something that we've seen in the pediatric population that's a little concerning that I'd like to kind of, I guess, talk about is fear of seeking medical help for risk of exposure to COVID. We've seen, a lot more patients presenting with more severe illness than we're normally seeing, or really unfortunate cases of, new cancer diagnoses that really presented kind of later, because families are scared to come to the hospital because they're scared of COVID. So we've also seen a really steep decrease in routine immunizations because parents don't want to bring their children to their doctors, or their doctor's offices aren't open. So our hospitals actually set up a routine immunization clinic to kind of bridge the gap during this situation. So I really obviously encourage people to be careful about COVID-19 and take the necessary precautions, but I really think we need to remember that if you need medical help, you need it, and you need to seek it out because it's your health and it's very important. So that's something I just like to, spread right now.
Those are great thoughts. Like, I didn't really know about the fact that immunization is kind of going down. I imagine if that's happening at your site, that's very likely happening here as well. So that's a great message to pass on. You can't overlook those types of things, especially with fall coming and winter.
Yeah, flu season. So
yeah. Great thoughts. Well, thank you both so much for joining me today. I really appreciate your time. I certainly learned something new about kind of pediatric practice and just in general about how COVID-19 is really impacting people around the world today. So thank you so much for joining me.
Yeah, thank you very much for having us. This was a really nice experience. Yeah.
Yeah, thank you very much.